Tomorrow, the 10th of October, is Mental Health Awareness Day with the objective of not only educating the public about mental health, but also to reduce the stigma and discrimination that people with mental illnesses are often subjected to. Pillay, who is a managing director of Youth Lab, joins us to talk more on this. Good evening to you, and thank you so much for your time tonight. I see you've launched a program called Psychology First Aid. How does that work in relation to mental health?
Thanks for having me. So the Psychological First Aid Project was really launched with the idea that at the start of lockdown, people were having to deal with the kind of stress and pressure that comes from having to live through a pandemic that no one else, has ever been through before. And as much as we were talking about the kind of health and social welfare interventions, we weren't thinking about what kind of mental health interventions people need. It was an incredibly isolating time for people, and we weren't able to support each other the way we usually can. And so this project was born out of that belief that actually we can get together and pool some of our resources and provide some kind of psychological support for people as they navigate the lockdown and the pandemic.
And how does it all work at a practical level?
So what we've done is we've gotten a group of psychologists who lead the project. And we have, because it's a project aimed at young people in particular, we separated people into kind of what life stage they're in. So we have a group for students, we have a group for young professionals, we have a group for job seekers. And what they do is they meet with psychologists in a group on a week-by-week basis. It's done entirely virtually, and we provide resource support like data for those who may need it. And our psychologists take them through a toolkit that we've developed that really just teaches people on how to better manage things like stress and anxiety, how to deal with things like depression and all of the other mental health issues that come up during, whatever people are facing right now. And so people log in once a week. And they have a 45-minute long session, and they also have home activities that they can do. It really is a dynamic toolkit that we've created that then gives people tools and resources to use even in their own time to just help them navigate things a bit better.
Do they pay for the service?
Absolutely not. So the service is completely free. We're actually running, or we're in the process of recruiting for our next cycle. So we've done this twice already, reaching across about 300 people. And sign-ups are actually now open on our social media pages. But it's completely free. If people don't have access to things like data, we provide data for them. But yeah, there are absolutely no cost involved.
Let's talk then about the pandemic. How have you seen the uptake of such a program being amongst young people?
We've actually gotten a really phenomenal response every time we've run this project. So like I said, we've only run it twice since the beginning of last year. And what it's shown us is that, number one, young people are actually they're seeking help, right? They're actually thinking about their mental health, and they're looking for ways to get support and also give support to each other. And so that behavior, I think, is not something we're used to seeing, especially as we think about the way mental health is perceived in South Africa. So the response has been really great. People are really eager to help each other. People have really worked with the toolkit really well. And we generally have gotten very big responses. And it just tells us that people are more aware of the importance of taking care of your mental health and are trying to take steps to actually rectify it and to get the kind of support that they need.
I wonder how many young men have you had as part of your program? Because, there's been a notion that men generally don't like talking about what they're going through. And how do you then get those young men to open up and talk about the pressures and the challenges that they're facing?
Yeah, that's a really great question. And actually, we found the same thing. So our participants have skewed largely towards women. I think our percentage of male participants is definitely less than half. And that's exactly the problem, right, is that we don't have an environment and a culture in which men feel like, number one, their mental health is something to be taken seriously, and that there are ways for them to reach out safely for help and get it. What we've done is, through the men that have been part of the program, we've asked for them to almost be ambassadors of the program and talk about what it's done for them, the kind of help that they've gotten, and help encourage other men to do the same and to join in. But it's a struggle we've also been facing, and I think a big conversation that we need to have is, how do we kind of create a culture in which men feel like their mental health is important and actually take steps to address it and to get the help that they need.
As a final question, how then would you say tonight somebody who's watching, they reach you, which are your social media platforms so they can be able to get in touch with you?
So the best way to get in touch with us is either Facebook, Twitter, or Instagram, and you can find us at YouthLabZA. And all of the information about the program, the link to sign up, and for any other questions that people may have, they can find us there. So it's at YouthLabZA.
All right. Thank you so much, Pearl, for your time tonight, and good luck as you then go for the second round of this very important psychology first aid program that you have started. That's Pearl Pillay, who's the managing director of the Youth Lab. Certainly a very important conversation we're having tonight around mental health.